Ionophoresis on infected root canals using Skorpion dental Optima. The movie is made under methodological guidance of Assistant Professor Maria Vasilova, Faculty of Dentistry, Sofia. Nowadays, there are a lot of high-effective root canals filling facilities and methods for outer voice treatment or special instruments existence, but very often it is necessary to use electrophoretic methods for medicines insertion in the dental canals and delta apical or for periapical area saturation. These methods provide opportunity for volume ions transition in microcanal system or at inaccessible locations in mechanical microcanal treatment. In a lot of cases, electrophoretic methods sharply decrease secondary infection risks due to insufficient sterilization. The movie shows the most popular method of canal ionophoresis using iodine potassium iodide. Ionophoresis principle consists of electrical current ability to take in or take out ions in or out vital tissue. This method is used in dentistry for hard teeth tissue saturation by medicines or for excluding their harming substances. The canal ionophoresis is applied to following cases: pulp gangrene, periodontitis, teeth which do not allow hermetic sealing, pulpitis with hard passable root canals, patients with medicamental allergy. When galvanic current passes through a root canal with inserted iodine potassium iodinate, potassium and hydroions obtained in electrolytic dissociation of water and potassium iodinate are directed to the pulp chamber. Negative ions of hydroxyl group and of potassium iodinate are pushed through the canal to the apical area. The negative ions have antibacterial effect in the dentine canal system and in periapical area. The release from the cathode potassium ion creates with water potassium base, which hydrolyzes proteins and soaks fats of the necrotic substance in the canal. Organic substances pulling products are getting out to the pulp chamber as electrolytic foam together with hydrogen bubbles. This procedure contributes to canal system's elimination of necrotic substances. Needed solution is prepared by modified Rubin's methodology. Crystal potassium iodinate is solved in 1-2 drops distilled water and 1-2 drops iodine tincture till solution saturation. In front teeth treatment, potassium iodinate is solved only in distilled water to avoid brown dyeing. To prevent teeth dyeing, root canals must not be treated with oxidizers as oxidized water or antiformine directly before and after iodine solution procedure. Alcohol flushing is used. Drains soaked in prepared solution are inserted in the root canals after mechanical and medicine treatment. A conductor is placed in contact with the drain. The conductor is positioned by mild dental wax or temporary obturative facilities. Fixing row isolated by polyethylene belt is placed over wax. The patient closes her mouth. The drains with medicine are inserted in every canal of multi-root's teeth. Depot, tamar soaked in potassium iodine solution, is placed in the pulp chamber. Connected to the tamper, the conductor is fixed. The patient is accommodated comfortably lying. The passive electrode conductive rubber, placed in wet hydroxyl bed, is fixed below or over patient's right hand and is pressed by a sand pillow. The active electrode clip is switched to the conductor. The procedure starts by pushing button start. The doctor directs her attention to the patient using the remote control. Button is pressed, pointer up, for increasing the current passing to the patient. The button is held pressed till reaching such current level at which the patient starts feeling shiver and shows this by the preliminary reserved sign. In case of unpleasant shiver, the dentist must decrease patient's current 1 or 2 stages. After reobey stabilization, the patient must quietly relax until procedure termination. The device informs the dentist about time expiration and executed procedure, lightly decreases the current and finally switches off the patient from the chain. The dentist takes the device active and passive electrodes out of the patient's mouth. The drain is taken out of the teeth canal. It must be colorless. This indicates iodine penetration in the dental tissue. Drains with chlorophenocamphor or lidosit are placed in the canals among procedures. They are sealed by temporary filling till next procedure. Usually 3 procedures are recommended. Root canals filling must be done immediately after the last ionophoresis. By the same way, in infected root canals treatment, proteolytic enzymes can be inserted. In hard exacerbations of chronic periodontitis, antibiotics can be inserted, for example, kanamycin. In pulp gangrene, periodontitis, and patients with medicamental allergy, cathode galvanization without medicine can be performed. In sharp and exacerbated periodontitis and in teeth which do not allow hermetic sealing, non-separative periodontitis, anode galvanization can be performed. Good results have been achieved in the recent years from the combination of canal ionophoresis and laser therapy as preliminary procedure. Ionophoresis method can be used for chemical substances tooth extraction. The process is known as elimination and is used mostly for arsenic product extraction.